Hi everyone, I'm Nicola Dalbeth from Auckland, New Zealand, and today I'm going to summarise a couple of really interesting abstracts presented at the ACR meeting in 2020, which demonstrate the potential effectiveness of adding immunosuppression to pegloticase to increase the response to pegloticase. So when pegloticase was initially studied in the phase 2 and phase 3 studies, it became apparent that a number of people did not have a sustained response to pegloticase. And overall, in the phase 3 study, only about 42% of patients had a persistent pegloticase response. And it was subsequently identified that this was due to anti-drug antibodies, particularly anti-PEG antibodies. And so there's been quite a lot of interest, particularly in the last couple of years, in whether adding immunosuppressive therapies that we use often in clinical practice in rheumatology, might reduce the risk of anti-drug antibodies and thus increase the number of responders to this therapy. So there's a couple of abstracts at this meeting which address this, and I think will be really useful for us in clinical practice. So the first one is poster number 0677, and this is data from the MIRROR study. So this was a 12-month open label study of methotrexate 15 milligrams per week in combination with pegloticase. So the 6-month data had been previously reported, and this poster now reports the 12-month data. So essentially 14 participants in this study. At 6 months, 79% of patients had a response, so that's certainly higher than what has been seen in previous trials. And in the open label extension or the long-term extension, all of those who remained in the study who were responders at 6 months continued to have a response out to 12 months. So certainly emerging data that methotrexate may be effective in this situation. We don't have any good clinical trial data yet, as in placebo-controlled trial data, but certainly some data to suggest that that's a reasonable or a potential option. The other agent is mycophenolate, and the recipe trial was presented at the ACR. This is abstract 0952, presented by Dr. Pegloticase today. So this is a phase 2 placebo-controlled RCT where participants were randomized 2-to-1 to receive either mycophenolate or placebo in addition to pegloticase. Patients received mycophenolate 1 gram daily for 1 week, and then 2 grams daily thereafter. And the primary endpoint was the serum urate response at week 12. Thereafter, from week 12 to week 24, participants continued with pegloticase, but the investigational product was removed. So that was then pegloticase monotherapy. So the key findings from this study is that mycophenolate in combination with pegloticase led to a significant increase in response. So in the mycophenolate group, 86% achieved the primary endpoint compared to only 40% in the placebo arm. And interestingly, even after mycophenolate was withdrawn, there was a sustained response in many of those patients. So at the weeks 24 time period, there was a sustained benefit in 68% of the mycophenolate group and only 30% of the placebo group. Overall, the AEs were comparable. There were 3 infusion reactions in the placebo group and none in the mycophenolate group. So overall, I think this is really exciting. Certainly a potential option for increasing the response to pegloticase, which, as we know, for those who do respond, leads to really substantial reductions in serum urate, reduction of tophi, and suppression of gout flares over time. Thanks.